Hey YouTube, this is day one post PRK laser eye surgery for my left eye. Local time's about 4 o'clock, so we are approximately 6 hours post operative procedure, and so far things seem to be okay. My vision is certainly not perfect yet, and with PRK apparently it does take months to get to a level of perfect vision. And of course, I'm not wearing any glasses anymore because I don't need it for my left eye, and I'm wearing an old contact lens in my right eye to help balance out my vision. So sort of what happened this morning? Well, I didn't sleep last night after posting my first video blog, just because I think the anxiety was sort of running high inside of me. I was pretty excited to get this done, but at the same time I didn't know what to fully expect after the procedure. So it was actually quite easy. The doctor's office took me in at 7:30 like they said they would. Made me go through a whole bunch of forms and made sure that I was comfortable getting this procedure done, and all that administrative nonsense, and to really pare it down. They take me, or prior to them taking me into the operating room, I meet the actual surgeon, and he goes, "Oh, we're doing this and blah blah blah. Do you want something for your nerves?" And of course, I said, "Yeah, absolutely." Right? I haven't slept all night, and my hands are starting to, kind of quiver, and they were all like blood red colored because, well, I am nervous, and I don't like anything to do with the human body and being modified in any way. And so he came in with this little pill called Ativan, and it was like a small dose, like half or a milligram. And I've actually used that before for anxiety, sort of situations. And I just simply went back and told him that I go, you might want to double or triple that, because I go, that dose ain't gonna do nothing for me, right? And so kind of gave me a funny look and came back with more bigger doses, which of course, when I took them 15 minutes later, I was as docile as you're gonna get me to be. And so I was nice and relaxed, and then the nurses come and they bring me into the operating room with my work jacket still on, and so I asked them, I'm like, "Oh, do I need to change my clothes or anything?" And they said, "No, it was just lay down on the table, and this should take a few minutes." And I thought, wow, it's that routine that you can just crank them through, like how Costco cranks through customers. It was actually quite impressive. So when I lay down on this gurney on the table, the nurse, says, "Okay, I'm going to put a numbing drop into your eye, and I'm going to tape a shield over your right eye so that you're not distracted with one eye over the other." Sorry. And then the doctor comes in and he says, "I'm going to now open up your eyelid, and we're going to proceed with the laser procedure," which I thought was okay. Well, that's great. And of course, he takes this tool, and it's got like these four pointy prongs on it, and he's opening up my eye and then trying to jam like the prongs under my eyelids. And of course, I thought, "Oh, okay, well, my eyes are numb. I'm not going to feel that." Nope. He even clearly stated when he was putting it in, because I didn't numb your eyelids. I only numbed your eyeballs. So you're going to feel a little bit of a prickly, sort of uneasy uncomfortableness with this thing in your eye. Like, great. So once he got that in, it was kind of a scratchy feeling. It actually kind of hurt because I think the very one end piece actually pricked me inside my eyelid. But, I mean, it's okay. I lived. And then, of course, the procedure right afterwards was, he says, "Oh, your vision's going to start to get blurry." And he never actually told me that he was removing the epithelial layer off my eye, but I had a sense that that's what he was doing, because he had put this liquid on, and it felt like it stung just a little bit. But then he brought this weird ring tool, and then he ended up pressing it up against my eyeball, and then he brought over like a spatula or a knife-looking thing, and he was kind of scraping away or doing something, within the confines of this ring on my eyeball. And then, my vision was going blurrier and blurrier. And of course, now there's pressure building up in my eyeball, because he's actually pressing down on my eyeball to prevent it from sort of randomly moving around like how our eyes normally would. And so, according to my wife, who was watching the observation room, she goes, whatever they were doing, he ended up picking up a thin layer of my cornea in the operating room. And she goes, it was a perfect circle of clear flesh. And she goes, that was the most bizarre thing that she'd ever seen. Done up so close, and so that clearly was the outer layer of my eye. And then right after that, they kind of flushed my eyes out. It smelled like distilled water. And then then they moved the laser module over your head, and then they tell you to focus on the little blinking red dot. And so I'm staring at this thing, and the doctor tells me, he goes, okay, he goes, you're going to hear a series of zaps, and you're going to smell burning hair smell. And I thought, wow, great, you're going to burn my eyeballs, and that's the smell? Gross. But it's not actually. It's the smell that I'm smelling is the laser operating, which does smell like burnt hair. And so I stare at this light, and it's going zap, 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 zap. And then, your vision, like you can actually see, like in your field of view, like 3 points of light, from the center of your vision, which I'm assuming is the laser shooting through into your stromal layer in your eye. And I thought, oh my gosh, like that's kind of scary, right? And of course, he told me just don't blink and just relax and he'll keep shooting. And so, not knowing how long this would take, I stayed as calm and as still as I could. I just did this continuous zap, 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 zap noise going on in the background. And then lo and behold, about 45 seconds to a minute later, he pulls the laser away, flushes my eye out with, I'm assuming, with saline or distilled water again, and then I can see overhead this clear circle, piece coming over my eye and then dropping it on. It must have felt like RoboCop being assembled or something like that, because it was weird looking at that. And then so that was actually the soft contact lens, which is quote unquote a band-aid for your epithelium on your cornea. And then he puts a few eye drops in my eyes, puts me back up on the table and says, "Well, how do you feel?" And I go, "That's it?" Like it was like a minute. Right? And he goes, "Yep." He goes, "That's how long it takes." And then, of course, my vision wasn't, there yet. But now, I'm sitting at home, and my left eye's vision isn't, dead sharp. It's still definitely very blurry and hazy. But remember, I'm only wearing one prescription contact right now, and I can see everything, which is pretty impressive. So I thought, wow, if that's all that laser eye surgery needs, I'm surprised that not everyone else is getting it done. However, that being said, the post-operative care is a little more of a nuisance for me. So here's sort of the schedule, if you guys can see it. And all those check boxes are basically, eye drops that you have to put in. I got Vigamox, I go Voltaren, and then I have this thing called FML, and then gabapentin. And basically what those drugs are is that, well, Vigamox is an antibiotic to prevent infection, and I have to put this into my eyes 4 times a day, every day. Voltaren is a like Advil, so Advil for your eyes. It basically is a NSAID, so non-steroid or anti-inflammatory, whatever it is, basically to take pain away from your eye. And so it's already been about 6 hours since I had the procedure done. Maybe even 8 hours now. 8 hours since the procedure is done, and I'm not really feeling some crazy pain yet. Knock on wood of some sort. But Voltaren is supposed to be used again 4 times a day, or even as needed to take that pain away. And then, of course, there's this product called FML, which is a natural steroid drop used to help stimulate the regrowth of the epithelial layer on your cornea. So super important, the doctor says, that I use these drops. Otherwise, the growth in my eye is going to end up getting clouded over, and I'm not going to be able to see properly. So that's not cool. And then last but not least, there's a whole whack load of sort of these artificial tears that you have to use every 15 minutes for the first 5 or 6 days, because your eyes are just bone dry. And I can attest to that, because apparently when you cut the nerves out of your eyeball, it also removes all the tear trigger nerves in your eye. So my eye actually doesn't know how to tell my brain to start tearing up and to lubricate the contact lens of the eye and keep it moist, and it needs that to survive. And then they've even given me one particular eye drop. I don't know where it is here, but I think it's this stuff here. It basically is eye-numbing drops that you need to use if your eyes are in severe pain. So let's cross our fingers and hope to God that I don't have to actually use any of those. So far, things seem to be pretty good. It's a little irritating right now because of that little contact lens in there. And I've taken a really long nap, so I'm actually feeling pretty good. So keep you guys posted on day 2 of surgery recovery.